Dr. Volz is not just a dentist. He's a systems thinker. During COVID-19, when fear dominated medicine, he stood open for open scientific dialogue, patient autonomy, and the power of nutritional and systemic resilience. At the height of the pandemic, he created a Swiss Biohealth Day, a space for courageous conversations. I was honored to be one of his invited speakers. He founded the Swiss Biohealth, and he also founded the ICBI, the International Circle for Biological Implantology. And through his work, he has consistently reminded the world of something simple but profound. The mouth is not separate from the body. Dentistry is systemic medicine, and I'll share something personal as well. When his daughter Coco wanted to further optimize her health, despite having access to world-class functional and anti-aging medicine physicians in Europe, he suggests her to come here to talk to us face to face. And it is not just a personal recognition. It is about trust. It is about shared vision about system medicine and about also molecular medicine without borders. Thank you. Without further ado, and Ulrich, it's all yours. Go ahead, please.
Yeah, hello everybody, and thanks a lot for having me here. I've placed me in front of the Uruguayan flag, so that's where I'm spending my time at the moment. So my latest, let's say, focus is on the ICBI, International Circle for Biological Implantology. Why implantology? If you go back more than 100 years, Weston Price, who supposedly was the most famous biological dentist ever, and as well in the American Dental Association, he was responsible for research and science. He found out that when he removed root canal treated teeth, and that's actually more than 100 years ago, that the patients mostly completely recovered. Then he placed those teeth under the skin of sheep and rabbits, and they developed mostly the same illnesses, the same symptoms than the donors. So that was super interesting. And I mean, since then, I mean, there was, I would say, never a more scientific dentist that we know in the past 150 years. And Hal Huggins, actually, he repeated those studies. But he had a big problem, because removing root canal treated teeth means he would create gaps, and gaps would mean the other teeth would lean over into the gap. On the other hand, he would reduce the bite height, and we know that that is going to reduce the blood inflow into the brain, and as well the lymphatic system, the lymphatic outflow, and so on. So he was kind of desperate, because he knew he had to remove these teeth, but he had no solution. That is always, let's say, problem is just as big as, let's say, the available solution. And so I'm very happy that I was able, as the first dentist, to develop, actually invent the first ceramic implants 26 years ago in 2000. And but I invented the ceramic implants because of the need to fill the gaps after the removal of root canal treated teeth. That was not a business concept. It was the need to have something biological and immunological neutral to put it into the gap, because once we remove the root canal treated teeth, and there's definitely nobody in the world who has removed so many root canal treated teeth than I did in the past 35 years, supposedly something like 40,000, and I placed about 30,000 ceramic implants. So I know what I'm talking about. and the patients are going to recover systemically because of the extraction of the root canal treated tooth. So the ceramic implant has nothing to do with healing. It's just not again compromising the health we created by removing the root canal treated teeth. If you place a titanium implant, yes? Here. Okay.
Okay. All
So,
right.
can you see it?
Yes.
Okay, so you see the ICBI starting master slide, right?
Yeah.
Okay, perfect. Okay, so that is why today I completely focus on ceramic implants, because that is just an immunological and biological alternative. And it's healing in a completely neutral sense and meaning. If you would place a titanium implant and you have improved the systemic health of the patient by removing root canal treated teeth, but you would place a titanium implant, what we know from all the study, it heals in the sense of a chronic inflammation, and it will be a chronic inflammation for the rest of the life. I will show that in a moment. Then you would again push the patient into chronic disease. And I think you might agree, I believe that the cause for all chronic disease, and aging actually is a kind of chronic disease, and we're talking about longevity as well, is equals chronic inflammation, silent inflammation, chronic stress, and that is actually caused by root canal treated teeth. So by removing them, you improve the health of the patients, but at the same time, by placing a titanium implant, they would just fall back into the old situation. And so I want to share with you a case. I have to get rid of this. Okay, perfect. That is just to give you an idea about a typical patient coming to our clinic, and you see there was all cavitation there, some mercury and some gold crowns removed. We did what we always do. We removed all the root canal treated teeth, removed the metals, removed the mercury, the cavitations, cleaned everything perfectly, placed a couple of implants and a fixed temporary. So we never leave a patient without fixed temporary. And as we can see, the patient that is right before the surgery and right after the surgery. This is a dear friend of Dr. Klinghardt, you might know him. And so he's the neuropath himself. And that is several months later. And you can see like his face, especially his eyes. So we take always very nice photos, especially of the eyes, and with high resolution cameras, and you can see they are kind of coming alive. So on the left side, it's a little bit more like Walking Dead, but on the right side, he's alive. It looks totally different. And so if we ask him, that is 2 days after 16-hour surgery, I will run the short movie for you.
Tja, ich bin Jörg Schröder, Heilpraktiker, alter Klingenanstecker. Ich mache Musik. Und ich habe jetzt diese Operation hinter mir vor 2 Tagen. Und die Veränderungen waren also sensationell. Ich habe vor 2 Monaten links, dadurch wurde meine Sehkraft extrem gestärkt wieder. Und gestern bei dem Entfernen von den Metallkappen, den Goldkappen, habe ich ein sehr, sehr angenehmes Gefühl bekommen im Bauch. Mein Bauch hat sich wieder richtig frei angefühlt. Dann wurde noch eine Nico entfernt, also von den vielen. Und da habe ich gemerkt, wie meine Prostata wieder wach geworden ist. Des Weiteren sind meine Schultern voll beweglich, wo ich bis jetzt immer Probleme gehabt habe. Und seit 15 Jahren, seitdem ich diese Goldgeschichten im Mund habe, habe ich immer Kopfschmerzen gehabt und die sind weg. Und ich kann jetzt plötzlich wieder aufrecht stehen. Vorher war ich immer so zusammengezogen und jetzt stehe ich wieder ganz normal und aufrecht und die Schultern sind frei. Ist einfach super. Also allein von den körperlichen Auswirkungen hat sich das gelohnt, abgesehen von den Zähnen natürlich.
So why was he smiling? because he talked 1 minute about the systemic improvements, and then at the end, by the way, the teeth are nice as well. I mean, he paid quite some money for the new teeth for the ceramic implants, but the focus is on the systemic improvement. And going back now in my experience, 35 years, and I'm the one who, as I said, removed the most root canal 3D teeth, placed by far the most ceramic implants, and as well I removed by far the most titanium implants. In the meanwhile, almost 4,000. And we suggest that the improvement in all chronic disease through the perfectly executed treatment according to the biological dentistry and biological implantology, as I set it up 35 years ago and improved it all the time, is about 60 to 70 to 80%. And so we do that in 1 day. And that is something why we are receiving at our clinics a lot of patients from systemic doctors, from naturopaths, from doctors like Dr. Klinghardt, Joachim Mutter, and many others, because they know without addressing a perfect clean treatment in the oral cavity, and you see that is then all the implants healed, it's the final crown and bridge work, and in the left lower it's the x-ray with the ceramic implants and a ceramic crown. So there's just ceramic implants, ceramic crowns, and glass ionomer cement. So no let's say resin or plastic or whatsoever. It's just glass ionomer cement, what they use as well to cement hip joints into the bone. So it's an absolutely biocompatible solution. And I think if Western Price would look down on the planet, would be super happy that now 100 years later we have got a solution. Let's have a look at the interference fields. The idea about the interference field is that a tooth would kind of always, all the time, kind of trigger organ or the meridian. And I mean, it was kind of invented, or at least found in.
Send it to my phone.
There is something in the speaking. Like in China, 2, 3, 4,000 years ago, like the meridians, and that is something what we use since decades. And just to give you an idea, it's the cavitations, that is kind of that bone in the jawbone. It's a root canal 3D teeth. It could be as well periodontic disease, what is actually super dangerous and life-threatening. We'll talk about that in a minute. It's titanium implants because it heals in the sense of a chronic infection. It could be as well if the bite is not perfectly adjusted. And of course, as well, amalgam filling. So I did my doctor's thesis 35 years ago about amalgam, on amalgam. So just to remind, I believe everybody knows about the meridians. There is certain connection what relates to all humans on the planet. If in China, US, in Switzerland, in Uruguay, in Japan, everywhere in the world, it's the same. That means certain teeth are connected with, let's say, certain parts of the spine of organs, and it never changes, and it's extremely reliable. So I took one as an example. It's a colon lung meridian, and so we know it starts in the upper premolars and goes through the lower molars, and then over the shoulder, elbow to the pointing finger, and so on. Of course, the colon, the lung is affected, L4, L5, the lower back. And that is something what is one of the meridians what is very, very often affected. And those are the teeth. It's actually the only meridian, so coming from the upper teeth, what is crossing the middle line and going to the other side. And I brought you a very nice case. I love it because this is a race car driver, and he came to our clinic some years ago, and so he could not perform anymore because he had huge back pain. And he said, Ulrich, look, when I'm going into the curve on the race course with 300 kilometers, I have so much back pain. I push the brake. It's unbearable. And what you can see that what we do, all the biological dentists, we would just project the meridian system on top of the patient, on top of his X-ray, and that is actually those teeth. And you see here in the right upper, you see one root canal treated tooth. It's the only root canal treated tooth he had. And that is like we do it all the time. So we check if there is, like you see here, L4, L5, that is the lower back where he had his pain. Then we check, we overlay kind of the meridian system, and we check, okay, there is something on the X-ray. Then we inject Brocaine. And before that, of course, we calibrate the patient. So I would ask the patient to lift his right arm, for example, shoulder, and or to move his lower back and so on. And I do that in all my courses, that I'm taking or making CT scans from the dentists participating at my courses, those who are having root canal treated teeth. Then I would on stage have a look on the CT scan and tell them what I believe, what I think where they are having their problems. For example, left knee, right foot, whatsoever, L4, L5, right shoulder. And in 95% of the cases, I'm right. Then I would calibrate, check what is the limitation. I inject Brocaine, 0.1 on the facial side, on the oral side, and 15 seconds later, in 99% of the cases, and I do that since 35 years, they will be able to completely move their shoulder, their arm, their knee, whatsoever, and the pain in L4, L5 is gone. And then the next day, mostly they would ask if they could have the teeth removed by our clinic and replaced by ceramic implants. That is as well why I believe I'm the one who placed, who performed surgery on so many dentists and medical doctors. I don't think that anyone else has performed surgeries on so many doctors and dentists. And what is amazing, and I love it because it creates an amazing network, and at the same time, from any of those, I can learn something. So, like in this case, the pain instantly improved, L4, L5, the pain was gone. Of course, then you have to extract the tooth and place an implant. That's it. It's super easy. It's something I could explain within 20 minutes to all my students. That is not a very, let's say, a difficult concept. It is super easy, super smooth. Obviously, then performing the surgery, placing the implant in the right place, or performing very, let's say, long surgeries like 8, 10, 14 hours. If we have, for example, to remove 20 root canal treated teeth, some titanium implants, and then placing maybe 24 zirconia implants, and on the same day placing the final, not the final, but the temporaries. That is quite demanding, physically demanding, but the concept itself is super easy. And I think what is important, what I already pointed out, is that this on the right side, you see the tooth, and then you see the gum, And there is a big gap. There is like a parodontosis, or actually periodontitis, inflammation. And that is, in my opinion, is like leaky gut. We call it leaky gum. It's more or less the same, and I believe it's even more dangerous, and one of the most dangerous situations what we could see in the body, because that is the ectoderm. And we know that is connected to a nervous system, to the epidermis and so on. But the bone underneath here, or the bone here, this is the mesoderm. And by having this gap, the bugs, the viruses, the
Dr. Volz just dropped off. Let's wait a little bit. He may be able to come back.
I don't know why, but my computer completely shut down. I have no
Out
idea
of
what
power?
happened.
Did you connect the
it's
power?
it's anyway. I'm now on my iPad, so I will move forward just without the presentation. I think it's anyway. It's pretty clear what to what's about. Yes, I was just talking about the gap in the case of periodontitis. This is like a Trojan horse, because normally if a bug or virus would attack a host on the skin or on the gum, there is kind of a defense system. And but in the case of a periodontitis, if there is a big gap between the gum, what is related to the ectoderm, and the bone, what is related to the mesoderm, it could instantly attack the mesoderm, that is the bone. So that is kind of a Trojan horse, and that is why it's so dangerous. And we know that in all the studies, it's about 70 to 80% they would find in the clots in the case of a heart attack or of a stroke, exactly the same pathogens that they would find in the sulcus, so in the gap between the gum and the bone. So if you ask me what is, in my opinion, the biggest advantage of metal-free implants, or let's say ceramic implants, compared to titanium, is it's the only known material where the gum connects to the ceramic. So it is even tighter connection between the gum and the ceramic than in any natural tooth. And in titanium, it would never connect the gum. So that is kind of a lifelong, let's say, periodontitis, where the bugs could go straight into the bone. Okay, can you hear me? Because
Yeah, yes.
Okay, very good. It was okay. So that is something what is, in my opinion, one of the biggest advantages of ceramic implants, that it connects to the gum, and therefore you will have a perfect sealing, what is even better than a natural tooth in ceramic implants if you compare it to a titanium. So let's move on to the second big group of, let's say, of interference fields. That is the root canal treated teeth. So the numbers is really making me sometimes sleepless. It's about 9 to 10 millions of root canal treated teeth we are performing in Germany per year. In the US, it was discussed as a business concept some 40 years ago, and they're now placing 30 millions of root canal treated of root canal treatments. That means they leave about 30 to 40 millions dead roots into their patients. What is a dead organ? And we know we would instantly remove a dead finger, a dead foot, like sometimes in diabetes patients, or like dead kidney whatsoever. And so we dentists are the only medical department who would have the idea of leaving a dead organ in the patient, what is going to of course affect the meridian on one side and disturbing all the energy, taking all the energy. That is what we are showing with the procaine injection, because obviously such a quick let's say effect and reaction within 15 seconds could not be related to chronic inflammation or silent inflammation. That is related to the, let's say, the energy what is blocked on the meridian through the dead tooth. But on the same time, it's going to release mercaptan, ethers, interleukin 6, and many other toxins, and that is something what is step by step kind of destroying the health and immune system of the patient, because normally infection should be addressed to the immune system. I mean, you all know that way better than myself. How is the cascades? But we all know when our body is not able to stop the infection, to stop the inflammation, and it's going to be a chronic inflammation for years and decades, it's creating chronic stress. And that is, of course, bringing up the cortisol level, the long-term stress hormone, the cortisol level all the time, and is destroying actually the health of the patient. And we know chronic stress equals chronic inflammation equals faster aging. And the dentists, they believe that they could treat a dead tooth through the root canal treatment. And I mean, anyway, like the treatment is let's say, stems from 150 years ago. They would go with some needles inside and try to get the rotten nerve out of the tooth. But we know that there's not just the main nerve. There are somehow 15,000 to 40,000 dentin tubules. What no dentist on the planet, even not with laser or any other or ozone whatsoever, it's impossible to clean it. No dentist is able to do that. And that means we are maybe cleaning the main nerve, but all the rest of the dentin is full of bugs. And the problem is that those dentin tubules, they are something like 5 to 10 micron. The macrophages are maybe something like 15 to 25 microns. And the bugs, the viruses, the parasites, whatsoever, they are something like 1 to 5 microns. So they could sit inside, and it's a little bit like the cat and mouse play. The macrophages are on the outside, they try to get inside and to kill the bugs. That is obviously is a little bit just to kind of illustrate how it works, but it's but the bugs, they would sit inside, they would replicate themselves, they would release a lot of bad stuff into the system. And that is why a root canal treatment is never going to work. It is creating a chronic inflammation for the rest of the life, as long as you would have the root canal treated tooth in the system. And as I said, the nice thing is that it's super easy. And I've trained thousands of dentists in this matter, and as well a lot of medical doctors, how to read a panoramic. You would have a look on the panoramic, you overlay the meridian system, and then you know exactly if the root canal treated teeth or infected teeth would match the, let's say, the health issues of the patient according to the meridian system. Then there is a chance of more than 95% that by injecting Procaine, it's going to improve the health of the patient instantly within 15 seconds. Of course, it's going to come back, the problems, within 8 to 24 hours. And I would say that dentists are happy about that, because otherwise no patient would come back and would ask to remove the tooth and to receive a ceramic implant if the injection would already solve the problem. So the injection with Procaine is kind of I call it a reversible extraction. So I could on the energetic side simulate extraction and then see if something improves. And the nice thing is the patient does not have to believe to any test. They feel it instantly 15 seconds later. That is why it's so nice and why it's so easy and super easy to apply. I could do that in any place. That is, I would say, to date, the worst interference fields are the root canal treated teeth, because we suggest that in the US population, just to give you an idea, there are something like about 300 million of root canal treated teeth, and every single year they are adding something like 30 million. And you could imagine what that is going to mean to the overall health of the patient. As well as I said, the periodontitis is, I would say, the most overlooked, because patients would say a little bit of bleeding here, a little bit of bleeding there, it's not so bad. Yes, it is very bad. It's a severe and life-threatening chronic infection. And as well, if there's a kind of a partly impacted wisdom tooth, it's exactly the same, because the gum is not kind of attached. So we call it attached gingiva to the tooth, but it's like open access for the bugs. And that is, I would say, the most overlooked. So now coming to the implants as another disturbance field, is that, to give you a number, again, the US, they are placing something like 2.5 million titanium implants every year. And the titanium implant, even if you would go on the most scientific congresses, they agree in the meanwhile that at least 25% are going to show periimplantitis, what is a non-curable systemic disease. Periimplantitis is nothing else than the parodontitis of the natural tooth. They just call it periimplantitis because it's around the implant. So it's as dangerous as the parodontitis, and it's going to destroy the bone at the same time. So we know through the latest studies, and I wanted to show you a lot of those, but anyway, since the computer is not working, I have to tell you about that. That the titanium implants, they are not stable. They are going to release titanium particles on the surface. Sometimes it's already through the friction when the implant is screwed in, or even with the drills. Then sometimes it's the titanium implants, they have like a surface coating or roughness whatsoever that could create a release of titanium ions, and that is going to activate the macrophages, and they are going to express TNF alpha and interleukin 6 and some other factors, and that will have some systemic effects. But at the same time, around the titanium implant, it's going to activate the osteoclasts. And activating the osteoclasts around the titanium implant, that is actually the perimplantitis, because it destroys the bone, and that is actually what the dentists, they would face. The patient would come back with pain, the gum is bleeding, there's a big defect seen on the x-rays. And it's the official numbers is the minimum is 25% after 5 years. And I mean, it's a non-treatable systemic, a non-curable systemic disease. And I don't think that in 2026 we want to talk about success rates of 75%. We want to talk about success rates at least above 90, 95, 98, 99%, something like that. And the point is, if you look at the official treatment concepts to treat a perimplantitis, that is to open the gum and then to smoothen the surface. That means you would actually, with a diamond or with a drill, you would remove titanium, so to smoothen it, and then you would polish it. But that means that you would have even more titanium particles in the site, and that is kind of pouring oil into the fire, or maybe even gasoline pouring into the fire. And we know that no treatment for perimplantitis is working at the moment. Even the latest numbers, they go in the meanwhile even up to 50% of perimplantitis after 5 years. And so if you go to the big congresses of the big organizations in the world, it's about 50% of the lectures are talking about perimplantitis. So that is, we call it a tsunami. It is horrible what's going on there. So that is, in my opinion, another growing in the numbers and in the percentage growing disturbance field, because what we know is with the year by year increasing EMF, the titanium implant is kind of an antenna, what is in a vertical position inside the head. And we know, and top ranked peer-reviewed studies show, if you would use your cell phone on your ear, even with 4G, it heated up something like 4 to 8 degrees. And we know above 41 Celsius, it's going to destroy the proteins. So that is, I believe, another reason why we are seeing year by year more and more perimplantitis, and as well the cosmetic industry, the supplement industry, and many other industries, they would put titanium oxide into it's kind of a nutrient color. So even the mozzarella is should be normally yellow, and they whiten it with I think it's E117, what is related to titanium oxide. And that on the other side, both together, is I wouldn't say that it's in the first place the fault of the titanium itself, but the titanium together with other metals in the mouth, like amalgam, like gold, like whatsoever, palladium, platin, and so on. And then by using fluoride, for example, that is as well causing a release of titanium oxide from the titanium implants. Then all the titanium oxide in the cosmetic industry, in the toothpaste, and everywhere. And on the other hand, the year by year increasing EMF microwaves, that is altogether making kind of destroying the, I believe 50 years ago, titanium was a pretty safe material to use, but today in our environment, it's not going to work anymore. Last but not least, I want to talk about cavitations. Cavitations is like a dead area in the tooth. So it's mostly in the wisdom tooth area, but it could show up in any other, let's say, area where a tooth was removed and it didn't heal perfectly. Why mostly in the wisdom tooth area? That is because if you talk to the surgeons, they like to remove the wisdom teeth in young adults, like in the age of 14 to 16, because the roots are not fully grown, so it's pretty easy to take it out. But that's exactly the age where they are having a quite fast growth in the system, and they're mostly lacking minerals and vitamins, and as well the nutrition might be not as good as maybe later when they are adults, or maybe when they're still in the, let's say, in the parents' place. And the surgeons, they get paid by the extraction or by the surgical extraction of the wisdom tooth. So sitting together with my colleagues, the maxillofacial surgeons, they would talk about, I do 4 wisdom teeth in 48 minutes, I do them in 40 minutes, and the point is, it's at least, let's say, in the US, in Switzerland, in Germany, it's like a super quick surgery. So a big cut of the gum. They remove a lot of bone to get the wisdom tooth out as quick as possible. Then they just do a suture, or they put just a strip inside and let it heal secondarily. And that is then later, it's not healing completely. So you will, from the outside, it would look like it is healed. But if you look inside and you measure the Hounsfield units, or even Dr. Lechner from Germany, Munich, he developed a system where you could measure it with ultrasonic. You will see that it's a hollow area inside. And so that is something we do as well since 35 years, that we open in all patients, 100%, all the 4 wisdom tooth areas, because I've never, ever seen a patient from no place in the world where there was not in all 4 wisdom teeth areas a cavitation in case they had the wisdom tooth removed before. And so then I would open them and I would see that everything is full of fat. So you can sometimes even with the suction suck all the fat away. And you would even sometimes see the socket of the former wisdom tooth maybe 20, 30 years later. And that is as well something what is quick and easy to perform surgery, is not causing any pain, not visible swelling, and but is creating a huge improvement of the health of the patient. And so to, let's say, kind to sum it up, for you, it's I think what is totally overseen is that that the medical doctors, they should study much more and know much more about dentistry, because all the meridians are running through teeth. All the teeth are in the area of the trigeminus, what is occupying 50% of the space of all the 12 brain nerves. Most of the senses are located around the teeth. So it's not far away like on the foot. It's in the middle of the center, right below the brain, the only organ you cannot transplant. And at the same time, it is let's say it is the only, let's say, organ what is sticking out of the body, or especially if you replace it by an implant. It is, if you would place a hip implant, it will be inside the body. So kind of an endoprosthesis, and an implant is a exoprosthesis. So it's like grown into the bone, but on the other side, it sticks out inside the mouth, where all the bugs and the saliva is the most, let's say, a dirty liquid in our body. So that is, I think, the special situation of the oral cavity. Can you still hear me? Hello? Can you still hear me?
Yes.
Okay, perfect. Okay, I was not sure. Okay, so I think it's a little bit of pity that I couldn't show you I had prepared a wonderful presentation, but I could upload it to you, Richard, and then you could share it with the audience, because they are beautiful pictures of cavitations, of root canals, and so on. I think it's very impressive. I would be now open for you to any questions what you might have regarding my quick lecture. Thank you very much.
Thank you very much, Ulrich. Great, excellent. Yeah, good comments. And also, yes, when you give us the presentation, we will see. I think we should be able to insert into this recording. And anyway, we'll make it available to everybody. And here, let me start with one comment, one question from the Tencent, a Chinese person here. The question is, does the fact that titanium materials carry risks also mean that it's best not to use titanium cups now? What do you think, Ulrich? Metals are everywhere.
What do you mean with titanium?
Basically, those teacups or these coffee mugs, or some of them I think are made of titanium, I suppose. Yeah, I think so, yeah. I saw a video not long ago. I think it was titanium. A Japanese manufacturer, they were able to make very, very thin cups out of titanium. I remember it was titanium. But anyway,
okay.
What do you think in general? Basically, the question I would expand a little bit is that, what do you think of our daily use of titanium products in our daily life?
Yeah, we should definitely avoid titanium oxide, and you should have a look at it. I mean, it's camouflaged as I think 117. So Thomas, I think he should know that as well. And just to use products without any titanium oxide. And of course, I mean, I would always prefer a nice ceramic cup instead of a titanium mug. I mean, there is no need for us to use metals, and
Yeah.
of course I would not use like an espresso aluminium capsule instead of having a nice real coffee or espresso from the Italian coffee shop. So, for example, I think we should be more conscious about metals. And so all my life long, I mean, I I performed my doctor's thesis about amalgam, what contains 53% of mercury, what is the most poisoning non-radioactive material on the planet. And then I went into the ceramic inlays. So instead of metal fillings, ceramic inlays, that is 35 years ago. And then the next step was I was one of the maybe 5 first dentists who started with ceramic crowns, was the same material, then the implants, the high-tech zirconia, and then we started the movement of the zirconia implants. And I mean, today it was not like this 26 years ago. We had quite some fractures, but today the ceramic is 2 times more stable than any titanium implant. And I believe in a few years we will be able to produce the ceramic implant in half the price or the costs of a titanium implant. So we have to understand that everything what relates to metal, we do not want to have any metals in our system. And especially like in the mouth, where is, as I said, an exoprosthesis and not an endoprosthesis, what is completely covered by tissue, like a hip implant, for example, a knee implant. So the tooth that sticks out of the gum, and that is the dangerous thing. So if you might have a hip implant, leave it, it's all good. But it's different if you would have a titanium implant. So in my clinics, we removed 100% of the titanium implants over the past 25 years. And there was not one patient who did not instantly on the treatment chair improve. So they would say it feels like you would take a helmet off. We have like a vision chart on the ceiling. So they are all able to read 2, 3, 4, 5 more lines right after the surgery. So that is very impressive. And that is, we have to be much more cautious what we get into our body, if it's about nutrition, if it's about supplements, but as well about everything what we are using in our daily life.
Okay, I will, due to time constraint, I will ask a lot of comments and questions here. I will probably have 2 more questions here. One is, let's do this. This is the important one. Is there any certified course to become biological dentist? I think that's an important one. Definitely, we want to get it started here for sure.
Yeah, I mean, I trained, I would say, 3,000 dentists in the past 26 years in biological dentistry / ceramic implants. I don't do that anymore, and I'm not, let's say, anymore in the corporate world. I did that 35 years. I'm now completely focusing on bringing so we know today that the ceramic implant is way better than titanium, but we are still missing the evidence. So that is why I focus completely, and I finance that by my own money with the ICBI, International Circle for Biological Implantology. So after 25 years to bring the evidence about ceramic implants. So I've started some retrospective and prospective studies, were the biggest ever performed. So to deliver the evidence, we know it works, and the field of ceramic is growing very fast. So what I would say at the moment, still, I would say the best course what you could take as a dentist is the ceramic implantology week at my former company, SDS, Swiss Dental Solutions. I'm not longer, since some time, I'm not longer having any shares on it, so I'm not related to the company anymore, because, as I said, I'm focusing on science now and evidence. But that would be one of the best courses. There is as well one of my students, Dr. Dominik Nischwitz, is doing nice courses. You should just I could share afterwards some links where you could take a series courses as well. I installed a curriculum for as being a specialist for ceramic implants and biological dentistry. So the patients, they would know that, and it's a super difficult curriculum, so they would know it's a certain standard, because obviously a lot of dentists, they want to jump on the train without having an idea about biological dentistry, and I mean the patients, they have to trust. That is why I created this curriculum. So that is something I would highly recommend. But I could share some links, that is, yeah, I think the best course is what you could take as a dentist at the moment.
Yeah, that's great. Actually, just to let you know that after talking with Dr. Volz and with Coco here, definitely I would welcome them to contribute more and more frequently as well to also American Medicine News Service. I think we're going to start covering more and opening up new issues over there. But anyway, we will have this conversation continue on email, on Substack, and on the other platforms. So due to time constraint, and we will move on to the next speaker due to late hours, Dr. Tom, the great Dr. Tom Levy. And I wrote a little bit beautiful thing for Dr. Levy too here. Let me see, let me bring it up here. And Dr. Levy probably doesn't need much introduction. He's worldwide famous for particularly redox medicine, also molecular medicine. And we plan on having him to talk about toxins. He just published a new book about toxins, and we all know toxins are probably the most important contributor to chronic disease and mortality. But then something new also related to toxin, but very exciting. And so I asked him to switch to focus on this. So without further ado, Tom, it's all yours now.
Okay. Can you hear me?
Yeah.
All right. Very good. Let me get going here. What I want to talk about, in addition to you see here, is a special therapy that we've developed. It's been developed, okay, for long COVID. I'm going to first say all the numbers you can check out in PubMed. Wherever there's a reference, there's a number, you'll see that. And let me also give you a presentation overview. I like to start out by showing you where we're going and where we're headed. And the title of my new book is The Only Cause of Disease, okay? And actually, I think Dr. Cheng will have a PDF copy. So if you want an ebook, you can have it for free. If you want a physical book, that's something you have to order from the publisher. But anyway, I'm going to cover very quickly, not too prolonged, the pathophysiology common to all diseases. I want to say also that Dr. Volz's presentation was extraordinary and excellent. And I think you're going to find virtually everything I'm saying coming into a nice connection and synergy with what he had to say, because it all has to do with oxidation. Oxidation is disease. And the only thing that causes pathological oxidation are toxins. It's really that simple, which then brings you to the point, well, where do the toxins come from? And that's where we talk the main classes. And I'll tell you right ahead of time, although I'm not going to really cover over what Dr. Volz has already covered, but the primary source of toxins are pathogens, either as colonizations or as gross infections. Well over 95% of all diseases and problems ultimately come from the oxidative stress induced by toxins coming from infections, nearly all of which are in the mouth. Okay, so big underline exclamation point for everything Dr. Volz had to say, because that's where most disease starts, and if you can get it taken care of, ends. All right. The main classes of toxins, then I'm going to address the spike protein in long COVID, and then I'm going to end up with a good piece of information for you on, believe it or not, a very effective way to completely resolve, yes, cure long COVID and the abnormal blood clotting associated with it. And I say that being fully aware of the fact that there is currently, to my knowledge, no known cure for COVID, long COVID, excuse me, chronic COVID. And that there's a lot of things that help make it a little bit better, but nothing that resolves it. All diseases are caused by and they're associated by the presence of intracellular biomolecule oxidation. Very simple. And this always occurs in one of two settings or a combination of the two. That is where there's too few antioxidant nutrient molecules present to keep a biomolecule in its normal reduced state, or too many new toxins coming in and oxidizing or reoxidizing biomolecules that have been, if you could say, repaired by the oxidants. Very important to understand definitions, all right? We always have in the literature just so many things that is very difficult to know from one article to the next if they're talking about the same thing. A toxic pro-oxidant, that's called a toxin, a free radical, reactive oxygen species, or very simply in the vernacular, if you will, a poison. And how do you define all of these things? Well, a toxin or a poison takes or causes to be taken electrons away from normal biomolecules, which are reduced. This is called oxidation. But the unique thing is there are things that take away electrons, but they don't take them away permanently. Toxins take them away permanently. So every time you have a toxin, it oxidizes a certain number of biomolecules and it traps those electrons, never to be released or distributed again. Antioxidant, vitamin C is the prototype, but there's many different antioxidants. And most nutrient molecules are nutrient in nature because they're antioxidant in nature. And quite simply, an antioxidant brings electrons back to oxidized biomolecules and restores them back to normal. Very important point here. All disease is increased oxidation. You see in the literature, increased oxidative stress is associated with just every disease. Type in a disease name in PubMed, type in the phrase oxidative stress, every disease has it. But they make the, not major mistake, but the erroneous conclusion that that must mean that oxidative stress causes disease. No. Oxidative stress, increased numbers of biomolecules no longer functioning, that is the disease. So the oxidative stress doesn't cause some downstream disease or process, because when you're able to stop the toxins, the new toxins, and you're able to repair the oxidized biomolecules, you start seeing cures, or in very advanced diseases, dramatic improvements. Very important too, biomolecules, nucleic acids, proteins, enzymes, you name it. But when you take their electrons away, one or more, you inactivate them. They no longer function. And that's the disease. Where they're located, where they're concentrated, that determines the disease process. Enzymes are a little more complex. They're very large molecules, and you can oxidize part of the enzyme and have a diminished percent function of the enzyme. You might reduce an enzyme to 50 or 40 or 30% of its function. And this is why different toxins cause, I just told you, all toxins cause disease by one mechanism only, and that's by causing oxidation, okay? You say, well, then how can you have so many different diseases? You have so many different diseases because of the nature of the toxin. The nature of the toxin in terms of, show you this next slide, its solubility, its molecular size, its ionic charge, its unique molecular structure, how readily it gets accumulated or excreted. These all determine how different toxins cause different diseases, even though the only thing they're doing is oxidizing different biomolecules. So the type of biomolecule, how long it's been oxidized, where it's located, extracellular, intercellular, the percentage to which that species of biomolecule has been oxidized, and in the case of larger biomolecules, by enzymes, the remaining function that's left. Okay. At the bottom of this slide, it's also important to realize we're talking about electrons. Electrons are life. You got a lot of electrons, you got health, you got decreased electron flow and distribution, you got disease. When it all stops, you have death. Okay. Not an oversimplification, I assure you. But when you have a very avid, not too many toxins, lots of antioxidants, always bringing and distributing the electron flow, you promote microcurrents, okay? And good currents inside a cell are a direct measure of its health. For those maybe that not good on their physics, very simply, current is electron flow, no more, no less. So antioxidants promote cellular microcurrents, toxins inhibit microcurrents by taking the electrons out of circulation. Now, something that's really not been known for forever until I sort of stumbled across this, but then it made a lot of sense, and that is antioxidants are not beneficial because they donate electrons, because they bring electrons in from the outside and donate them. They are beneficial because they distribute the electrons that are already present in the system. So you get your new electrons from your diet, and how well those electrons get everywhere they need to go is determined by your intake of antioxidants and vitamin C. And we know this because we have studies that show that oxidized vitamin C does as much or more good for patient models research. You see here where it is able to prevent and repair brain damage from animal studies where they induce a stroke and they infused oxidized vitamin C, and it had a profoundly positive effect. Well, that means it wasn't the electrons vitamin C was bringing in, because it wasn't bringing in any electrons. It was only diffusing throughout the body and properly distributing the electrons that were already present. And so, in a nutshell then, optimal supply and distribution of electrons determines the health. Electron supply comes from quality nutrition from the outside. Electron distribution, which is probably your primary determinant of health. I mean, you do need to bring the electrons in with nutrition, but they do you no good if you don't distribute them. That's why you can have somebody who's eating a lot of food, but if it doesn't have any vitamin C in it, they're still going to die of scurvy, even though otherwise their nutrition is good. They're not necessarily wasting away. They're not just getting the things in it that need to get the electrons around through the body. Query very quickly, we know this too because we have evidence already in the supplement industry. The supplement industry thinks that an antioxidant is not good if it's oxidized. So they only sell reduced supplements, with a few exceptions. Coenzyme Q10, ubiquinol, and ubiquinone, reduced and oxidized. Those both have powerful positive effects. Same thing with vitamin K2, menaquinone, same thing. And very significantly, although I'm not going to go into a greater detail on it because I'm going into something else, is a very super powerful antioxidant is methylene blue. And we have a host of studies that show that methylene blue by itself can resolve advanced septic shock. But when it's blue, it's oxidized. So all the ways in which methylene blue is coming into the body in the oxidized state. But it's very powerful at getting everywhere it needs to go, picking up the electrons where they're available, and then redistributing else throughout the body. Also, I want to erase a fallacy that's out there about the power of antioxidants. We have this test. I'm not crazy about it. It's the ORAC test, the oxygen radical absorption capacity. This is supposedly a measure of the power of an antioxidant. Basically, it just measures how easily an electron is given up. And then it says stuff like astaxanthin, which is a very good antioxidant. I'm not dismissing it. A lot of good studies on it. And they say by ORAC value, astaxanthin is 6,000 times more powerful than vitamin C. Well, guess what? Nobody dies of an astaxanthin deficiency, but they do die of a vitamin C deficiency. It's called scurvy. So, and that's because vitamin C, the power of an antioxidant is much more involved in how well it gets everywhere it needs to go. Astaxanthin is fat soluble and doesn't get well in the water soluble compartments. But C is small, all the cells, it uses glucose transporters, and it also has other active transport mechanisms independent of the glucose pathways, reaches all the cellular compartments, can move 2 electrons rather than just 1, making it, if you will, doubly potent. Also has a stable intermediate form that works to buffer either excess oxidation or reduction. And as I said, it's essential to life. So quickly in a nutshell, the concepts of redox biology. Electrons are the fuel of life. The combustion, quote unquote, of this fuel is nothing more than how readily electrons flow from one molecule to the next. In the case of vitamin C and other antioxidants, they go from reduce, oxidize, reduce, oxidize, reduce, oxidize. That keeps the electrons flowing. All toxic effects are caused by oxidation. And finally, increased oxidative stress is disease. It doesn't cause disease. Now, I want to quickly make some comments that I think are benefit because I cover them in detail in my book, but we have a limited time here, so I want to point them out. Where Dr. Volz was talking about inflammation, okay? Very important, and it's discussed in detail in the book. Inflammation, where it occurs, is severe vitamin C deficiency. Where you have vitamin C deficiency, you have inflammation. They are different ways of describing the same state. You cannot have inflammation unless the tissue gets severely depleted of vitamin C. If by another mechanism you deplete the tissue of vitamin C, it is inflamed, okay? And also very important is we're talking about cortisol and everything, very big topic, but I'm only going to give you a few words on it. The reason why inflammation and stress raises cortisol is because the primary purpose of cortisol is to usher more vitamin C inside the cells. So when you're depleted of vitamin C in your tissues, your body reflexly starts making more cortisol in a vain attempt to put vitamin C inside the cells, but it's not there to be put into the cell. In all these cases of hypercortisolemia, even Cushing's disease, you can all bring those levels of cortisol way down and oftentimes normalize them by finally getting large amounts of vitamin C in supplemental form, as well as a healthy diet. Also, I want to make a point about periodontitis. As Dr. Volz said, I mean, that's really the initiator, if you will, of nearly all significant dental disease. I mean, I don't think you ever get an infected tooth, unless, of course, you fracture the tooth up front. But if the tooth stays intact at the top, the only way you get it infected is by the retrograde introduction of pathogens into the root tip from gum disease, from periodontitis. Therefore, I would submit to you a very good thing to remember for your patients, for yourself, for your family, for your friends. The best single thing, there's many things you can do. The best single thing you can do for your long-term health, assuming you don't have root canals, because you're not going to take care of them unless you extract them, or other infected teeth, is to have a water pick with a content of hydrogen peroxide, because you don't get periodontitis, which is inflammation, unless you have pathogens growing in there, because pathogens are your greatest source of electron-consuming toxins, of oxidation. When you're able on a regular basis to get those pathogens out, nuked by the hydrogen peroxide, it's incredible how quickly the gums heal. And once the gums heal, if you don't have gum disease and your teeth are otherwise in good shape, you're not going to get infected teeth unless, of course, you violate the structure of the tooth above. Now, so what are the promoters? What are the main toxin sources that we need to deal with? One, as I just said, infections. The other, and this is important too, don't have a lot of time to go into this, but what else do the infections in the mouth strongly do? Is they're always leaking pathogens which then colonize the mucous membranes of the nose and throat, chronic pathogen colonization, not a gross infection, but a colonization, but they're growing. They grow and they die and they produce metabolic oxidative byproducts. They release a large amount of free iron when they die. And what are you doing with all of those sources 24/7? You're swallowing them. And as you swallow them, you screw up the gut, leaky gut, abnormal microbiome, which then magnifies the problem that we're talking about of getting pathogens and toxins throughout the body, which the dental infections do by themselves. And then the dental infections secondarily do that by keeping the gut in an abnormal state, producing pathogens and allowing them to cross the leaky gut barrier. The other thing that helps nuke this, that should be done in conjunction with the water picking with the hydrogen peroxide in the water in the solution, is periodic hydrogen peroxide nebulization. This nukes the pathogen colonization and gives you a new start and often normalizes problems with the gut. The other things, we're talking about the titanium. I mean, it's a good thing to avoid all intact metal exposure to your body. Of course, there's some worse than others. There's the heavy metals and mercury, biggie, antimony from plastics, all the other ones, the cadmium and the lead and all these things. These all are not only highly toxic, but they accumulate. You don't generally excrete them unless you have a chelation program. So toxic iron, dietary toxin exposures, low sex hormone levels. So principles for treating all disease: prevent new toxin exposure, neutralize toxins already present, excrete toxins in as non-toxic a fashion as possible. Remember, all detoxification involves some degree of retoxification. You mobilize toxins, 100% doesn't leave through the urine or the stool or the bile, and some get redistributed. So always have some retoxification. You need obviously to resolve infections and chronic pathogen colonization, supplement optimally, and very importantly, address hormone deficiencies, most prominently the sex hormones, thyroid, and low cortisol levels. Now, this is an important slide. It's the main premise of my book and a very important premise of this presentation. It's my opinion. I haven't done an extensive study to tell you this, but I'm going to tell you that except for populations that are severely malnourished, greater than 95% of major medical conditions are directly attributable to pathogens and their toxic byproducts and their content of high content of free iron, and they're most commonly in the mouth, but they can be anywhere else in the body. And in all the chronic degenerative diseases, you end up nearly always, if not 100%, because that's why it is a chronic disease, is you have on-site, like in the brain, Alzheimer's, Parkinson's, and other tissues, they've cultured out oral pathogens from the tissue. So you have an on-site, low-grade pathogen colonization in diseased tissues, and that's what continues the new supply of toxins, so that good antioxidation doesn't resolve the disease completely. No, they continue to progress. Number two is accumulated heavy metals. And I'll briefly tell you that in the case of heart failure and large hearts, they've shown by biopsy enormous concentrations of mercury and antimony and other heavy metals in this tissue, on the order of many thousand-fold, that's like 1,000,000% more mercury and antimony inside failing hearts than in normal heart cells. And finally, number three that I'm going to concentrate on for the rest of this presentation is the persistent spike protein seen with long COVID and with abnormal blood clotting. And right now, the statistics would tell you that roughly 20 to 25 million Americans have long COVID and a persistent spike protein syndrome, and 300 to 350 million people worldwide. It might even be more than that. I think these are conservative estimates because virtually all the chronic COVID comes from one or more of the vaccinations, if you want to call them vaccinations. Okay, they're designed they're designed to deliberately put spike protein in the body, which the body has demonstrated a complete inability in many people to metabolize and get rid of. So once you put it in there, it stays there. Now, I'm going to focus now on the concept of ultraviolet blood irradiation. Now, blood irradiation is one of a number of biooxidative therapies. When you're dealing with pathogens, you have vitamin C in different applications, hydrogen peroxide in different applications, ozone in different applications, ultraviolet blood irradiation in different applications, and hyperbaric oxygen therapy. All 5 of those really use similar mechanisms to ultimately have a pro-oxidative effect. And this is interesting because you're giving something to deal with oxidative stress, okay? The reason why they work is virtually always they're destroying the pathogens that are causing the increased oxidative stress. And then ultimately, even though they're pro-oxidant in nature, killing all the pathogens, then the antioxidant status of the tissue is restored. So now in the case of ultraviolet blood irradiation, this is a procedure that's been around a long time. This physicist in 1801, Dr. Ritter, a German physicist, initially discovered ultraviolet radiation simply with this mechanism of using silver chloride soaked paper. And then when he used a prism to break up the light, he found that there was an invisible light that converted the silver into darkness. And he eventually discovered that it was something we now call ultraviolet irradiation. Now, in 1903, the Niels Finsen received the Nobel Prize in Physiology or Medicine for his work on light therapy and skin diseases, and most particularly, he found that lupus vulgaris, which has a TB-like bacterium, responded very well to ultraviolet light therapy. And this was apparently just about the first time anybody had demonstrated that for a direct condition and irradiation, this could result in death of the pathogen and resolution of the disease. In 1920, then, a couple of German surgeons found that severe infections and even gas gangrene could be substantially improved, sometimes resolved by injecting pure oxygen directly into the venous system. It later on turned out this wasn't a terribly good therapy because some people would inject too large a volume, and even though small amounts of oxygen are easily assimilated into the circulation, large amounts of oxygen, like any other gas, can eventually cause a space-occupying gas embolism. However, now the first time a human was treated with ultraviolet irradiated blood occurred in 1928, and Dr. Emmett Knott in Seattle showed that this was possible. And it's now since been established, and you have all these references if you're interested and you want to reference them. If you go to PubMed, type in those numbers. It's now been established that ultraviolet light irradiation by itself, and this can do it by just light. I mean, you see the blue lights on top of toilet seats. That's a killing of any pathogens that were left by the previous user. Ultraviolet light irradiation, both directly or into the blood, has been established to readily inactivate or kill many pathogens, including the COVID pathogen. This has actually been studied already. Some of the early studies that showed that ultraviolet irradiation of the blood in 100% of 47 patients quickly and readily cured early to moderately advanced spinal type polio infections. And of note, this is important, the ultraviolet blood irradiation was shown to cure them all 47, as a monotherapy, no assistance. That doesn't mean you shouldn't try to use other things. Obviously, use as many things as you can, but just know that you have a very powerful therapy with ultraviolet blood irradiation. Since then, again, covered in a nice review article, many infections and medical conditions have been cured or greatly improved with ultraviolet blood irradiation, including viral hepatitis and advanced sepsis. Now, in 1956, Dr. Worley, a Swiss physician, came along with the idea of what he called hematogenous oxygen therapy. This actually combined two of the earlier things that were done by themselves. It combined the exposure of the blood to not only ultraviolet light, but also to oxygenation. You had the physicians that injected with oxygen, and you had the other individuals that just used the light. This combined the two things together. So it sort of evolved the original knot technique of blood irradiation with intensive oxygenation. The procedure was quite simple, although not as simple as it's been made today. Dr. Worley would foam about 100 cc's of blood with pure oxygen, then irradiated with ultraviolet light. No specification as to the frequency, and that's an important point, for approximately 10 or 15 minutes, re-injecting the patient. He had some difficulties because it appeared he didn't anticoagulate the blood. So there was a problem with the blood clotting and this sort of thing. At the time, it was still felt clinically that this improved blood flow, especially microscopic blood flow in the capillaries, which of course you would always consider to be a positive intervention for any condition at all. If you improve the blood flow, you improve the perfusion into the small vessels, you're delivering more oxygen to the tissues. It's that simple. Now, the Swiss naturopathic physician, Dr. Fabrice Lau, he's a young fellow, alive and well in Switzerland. I had the opportunity to spend a lot of time over the past 5 years, but especially 2 years ago, he was still dealing with a lot of long COVID patients. And he saw Dr. Worley's work. He saw the fact that oxygen helped, that ultraviolet blood irradiation helped, and he modified the procedure by taking 2 50 cc syringes. One, he'd withdraw 50 cc's of blood and put a little sodium citrate in it to keep it anticoagulated. And they'd had another cc of 50 cc's of pure oxygen, and then had them connected by basically an IV line. And then he'd lay this IV line down in his ultraviolet machine, which I'll show you in a later slide. And as he called it, ping pong, back and forth, back and forth, back and forth, as much of the blood and as much of the oxygen, cause a lot of microbubbling, cause a very bright red improvement in the physical appearance of the blood. And then after 3 minutes of this, get as much of the blood in one syringe and then re-inject that blood into the patient. Some of the microbubbles can go in, it's not a problem. And Dr. Lau will routinely give some of those bubbles as well. So it doesn't have to be too compulsively worried about you're giving something that can cause an embolism, because number one, they're tiny bubbles. Number two, they're oxygen, they're not air or nitrogen. And this was done, whole procedure taken maybe roughly 15 minutes. This is important too. We have a lot of ultraviolet machines out there. The Riordan Clinic, which is now doing this procedure, has done for a long time ultraviolet light treatments of the blood. And they'd even treated some long COVID patients before with this, and they'd get better, but they wouldn't resolve. Well, the thing is this ultraviolet machine used by Dr. Lau in Switzerland is a Kastner device manufactured by Hansler Medical in Germany, but very significant. It only delivers a single wavelength, 254 nanometers. I don't know that Dr. Lau knew this ahead of time, but this was the machine that he had. And as it turns out, that particular wavelength is marvelous because he started seeing all his chronic COVID patients, all his long COVID patients, simply be cured. By cure, and I'll give you a little definition of this in a moment, but the point is we have literature that shows that this specific frequency is very potent, especially for the COVID pathogen. And the point about, say, well, why not use a wide spectrum? Why not get in all the wavelengths? Well, you got to remember, take as an analogy, what does a multivitamin, multimineral do for you? It gives you a lot of different things, but practically nothing of a single thing. So a lot of variety, but very little of anything. Same thing with the wavelengths in a multi-wavelength ultraviolet machine versus one that's delivering with great intensity the frequency that counts the most. And that's the case here. So you're not getting a small amount of a wide range of frequencies. You're getting a maximum amount of the frequency that's really shown to be effective. Now, this is covered in these articles. If you want to take a look at them, this 254 nanometer wavelength is especially well absorbed by foreign proteins, which is what we're talking about with the spike protein. And it results in their denaturation. It specifically disrupts the RNA and DNA of these pathogens. And it's already been shown that in ultraviolet blood irradiation in general, bacteria and viruses appear to absorb roughly 5 times more photonic energy than the circulating red and blood cells, so they sort of self-target themselves. Also, specific studies have been done that show the ultraviolet C light has been not only shown to break down the spike protein, but to unfold it. And when it gets broken down and unfolded, it can no longer bind the endothelial cell or whatever other cells are in question. So while you're dealing with getting rid of the spike protein, you've already denatured it, so it's no longer going to have the same toxic effect as it had when it was completely intact. Now, what else do many long COVID patients have? They have elevated D-dimer levels. This is a very important test. Everybody, I'm talking everybody at all ages, but especially us older folks, need to have a baseline D-dimer test because it better doggone well be normal, or you've got a lot of work to do to get your health back. What many long COVID patients have, because of the persistent spike protein binding receptors in the endothelial cells, this causes an activation of the blood clotting. D-dimer basically measures the breakdown product of blood clots. So when you're clotting more blood, you're also at the same time breaking down more blood clots, so that the D-dimer measuring more blood clot breakdown products means that there's more blood clotting taking place. Very straightforward. Sometimes these patients don't have circulating spike protein, but they have it in the extracellular space and inside the cells, and they may not have an elevated D-dimer level, but they're still dealing with the spike protein, but it's just not having this very nasty effect on the endothelial cells of the blood vessels, which, of course, when you're talking about increased blood clotting, you're talking about pulmonary embolus, cerebral thrombosis, coronary thrombosis, all the major problems that take you down quickly. Now, the D-dimer levels have been consistently elevated in chronic COVID patients, and especially nearly always. I mean, if you're a vaccinated individual with thrombotic complications, your D-dimer is going to be elevated, anywhere from minimal to astronomical. And it's also been well established, independent of COVID, that patients with higher D-dimer levels for longer periods of time, quite logically, are the sickest and show the greatest mortality rates. So as I just said, everyone needs a D-dimer test. Why is this? Long COVID, especially if you've been vaccinated, if you were wary of the vaccination and you never got it, and you got COVID and you got over it, you probably didn't activate it. Some people that get COVID and never get vaccinated have a poor enough immune system that they still end up maintaining a chronic spike protein, but nearly all of the peak chronic long COVIDs are those that got vaccinated because it's specifically designed to bring and deliver more spike protein into the body. So everyone needs a D-dimer test as a baseline, just like you need a glucose or a hemoglobin test. Anybody know what their blood sugar is or what their hemoglobin level is if they don't check it? No. So you don't know if you have diabetes or anemia if you don't check those tests, and you don't know if any of the incredibly different symptoms that you can have with long COVID and chronic circulating spike protein. You don't have to be deathly ill. You could be minimally ill or not really ill at all, And if you're maintaining an elevated D dimer, you've got an increased clotting diathesis, and you need to address it as though you are suffering from a full-blown syndrome of long COVID. And of course, it's well established too now, unfortunately, that these long COVID patients, even though they've felt like crap now ever since they had their vaccination 1, 2, 3, 4, even 5 years ago, they stay sick and they never get better. And if something like the intervention I'm going to talk about doesn't get done, they'll often get new and quick and rapidly progressive cancers called turbo cancers, which are just developing in all the different odd areas of the body. If you look at autopsy studies on COVID patients and vaccinated patients in particular, you will see positive spike protein in virtually every tissue of the body. Important to note that the spike protein itself is intrinsically toxic. Remember what at the start of this presentation, I talked about all increased oxidative stress that is disease is caused by toxins. And in this case, the spike protein itself is the toxin. D dimer levels, this is important. Quote unquote, the normal D dimer level is 0.5 milligram per liter or 500 nanograms per cc. So you'll see some laboratories, you'll see a 0.5, others you'll see a 500. Same amount, it's just different parameters, different measurement parameters. Now, laboratories and medicine doesn't like to make everybody sick. So even when a lot of people have an abnormal blood test, they try to make the normal, quote unquote, normal level such that most people are not abnormal. Well, in the case, I'm going to tell you a D dimer of 500 or 0.5, in my opinion, based on the stuff I'm going to show you, is still too high. You shouldn't really start feeling comfortable about your D dimer level until it's 350 or less. Now, and that's what we talked about here. And that's the other thing too, is I don't know how you can get a false positive D dimer test. If you have too many blood clot elements in your blood, you're clotting your blood too readily, and you're going to be prone toward a wide variety of problems. Now, not just chronic COVID, but D dimer can temporarily be seen elevated in pregnancy, trauma, post-op, any inflammatory state. Remember, inflammation is diminished vitamin C and cancer. Now, the advanced ultraviolet blood therapy is now being utilized at the Riordan Clinic on a regular basis, and already it's got fabulous results. The originator of this therapy, Dr. Lau, in Switzerland, over the past 3 years, 2.5 years, has clinically resolved long COVID in over 100 patients. Roughly 95% plus of the people with long COVID symptoms that came to him. When he initially told me about this, was all excited. I said, you know, I believe you, but nobody else is going to believe you unless we can get an objective parameter to go along with it. Well, as I said, all long COVIDs don't have elevated D dimers, but many do. So I said, Dr. Fabrice, start doing D dimers. Well, as it turned out, he started then getting patients with chronic COVID, massively elevated D dimer levels, and after 1, sometimes 2, and virtually never more than 3 of these treatments over a several-week period, not only would the symptoms normalize, the D dimer would come plummeting down to normal. I mean, levels of 1,500, 2,000, 2,500, 3,000, back down to below 500, and often below 400 or 300. Now, a benefit of the Riordan Clinic in doing this too, and there's nothing wrong with seeing Dr. Lau. There's not many places still on the planet that do this. One of the reasons why I'm giving this presentation is because everybody should be doing it. Everybody should be taking it. I mean, if you have something that dissolves blood clots that shouldn't be there, this improves your microcirculation. It makes not only healthier, but it also makes any chronic disease you're dealing with much easier to manage. And Dr. Lau has since been doing this on just about all of his patients. And I'm not going to say he cures them like he cures the long COVID, but they all do dramatically better above and beyond how they had responded to all the other therapies. Some patients that have really a high toxin spike protein load, you lyse a lot of it and they get a little bit of the Herxheimer type reaction. They feel a little bit worse before they feel better. This can last for several days, but the Riordan Clinic can also follow this with an intravenous vitamin C infusion that will rapidly neutralize the toxins and get the patient feeling better before they leave. And that's always good in any sort of clinical context, is the patient should be feeling better before they leave if you want them to come back. Now, what I'm talking about, normal and abnormal D-dimers levels. Dr. Lau took his 23-year-old son, who was not diagnosed as having long COVID, but was just feeling a little fatigued. And he had a 200 D-dimer before he started. I mean, by traditional standards, that's very low. So they did the treatment, and a follow-up D-dimer at 2 weeks. 2 weeks later was 300. Probably spiked a whole lot higher before it came down to that 300. And here's the really biggie. The 3-week D-dimer, when everything is settled down, it was down to 100. So what's the really normal D-dimer? Well, I think we're looking at it right there. You're mostly going to find it only in young people, because all of us, as we get disease and have problems, there's always blood flow problems involved as well, which is going to cause and result in some sort of increased microclotting. But like I said, we don't like to tell people they're abnormal. So we're sort of sticking with this 500 being as the normal test, but I'm telling you, it's not. Now, this is in the Orthomolecular Medicine News Service back in 2023. But you can click it. This is on my website. Dr. Fabrice and I put an article together and showed on a number of case reports how well this worked. And these are actually some videos that show the process. It's very, very simple, but it's always good when you're starting something to actually get a little visual impact as to what's being done. And here's some studies specifically on this ultraviolet light frequency of 254 nanometers that showed it's clearly more efficient than even a slightly lower ultraviolet wavelength in inactivating the SARS virus. Now, as I said, if you could knock out and normalize D-dimer elevation, whether you're treating long COVID or not, I submit to you this has profound implications for world health and virtually all conditions. I mean, I would say right now, my big three are, because of the effect of pathogens causing oxidative stress, it's water picking with some hydrogen peroxide, nebulizing with peroxide vapor, and getting at least one or more of these treatments, documenting that you then have a solidly and maintain a solidly normal D-dimer test. So I've covered all these other slides, and what I've been telling you is that everybody benefits from increased blood flow. This is the machine, very simple machine. The IV line with the two syringes is just, you open this up, place the line down there, close it, turn it on, and then ping pong back and forth for about 3 minutes, okay? The manufacturer is Hansler. We have a United States representative. I have no financial involvement in the selling of this machine at all, okay? Although I had to go to some effort with Dr. Lau, because when we finally realized what was going on and decided we should get this word out, Hansler Medical had stopped making the machine. So Dr. Lau got on the phone with them, had them realize the important impact they were having on chronic COVID, and they started making the machine again. So Michael Corbett at this number and at that email address can be reached for more information, at least in the United States. I mean, everybody has their import problems, so I can't speak to other countries. I suppose if you're in Europe, it might be a whole lot easier, and you could get it directly from the Hansler people. And this is my website, okay, which has all my articles. It also has links if you care to get a physical copy of the book, if you like the PDF copy that Dr. Cheng can provide to you, and my email address. I always answer my emails, but I don't give consultations. And rather than indulge 10 or 15 different questions, I'll generally, if one or two questions are simple and straightforward, I answer them. If not, I put you in contact with information sources where you can help get the answers you're looking for. And that's it. Thank you.
Well, thank you very much, Tom, for another great talk. And any questions? Anybody? Let me see. Do we have any here on the question on the chat room? In the chat room here, I see one from Dr. Lux. Does long-term air pollution and microplastics exposure tied to increased Alzheimer's risk? I'm pretty sure it does. Air pollution for sure, yeah.
Well, sure, but the important point I want to make there is chronic pathogen colonization has been identified in Alzheimer's. And I submit to you that if they actually did the studies, they'd find chronic pathogen colonization is present in any tissue that's chronically diseased, but is not resolving with good antioxidant and nutrient therapy. In other words, meaning they have on site a source of new toxins continuing to keep the diseased tissue in an oxidized disease state. Now, air pollution and microplastics, what are those? Those are two more toxins. So yeah, the more toxins you add to this toxin soup, the worse you're going to be.
Yeah, I want to add here. Recently, I just published a paper on what I call systemic leaky barrier syndrome. So the way I see it is, as Tom and also Dr. Volz mentioned earlier, leaky gum. That's another thing is that basically our body, we know our body is protected from the outside, our brain, our eyes, our, kidney, our tooth and everything. So we are protected from outside from the exposures of these toxins, of the, the hazardous materials outside. These toxins, they destroy these barriers. So the way I understand it in an integrative or systemic way is that these toxins are non-specific, mostly. They damage anything. So when they damage your gum, damage your gut, leaky gut, damage your blood-brain barrier, the BBB, leaky brain, I call it, and then your lungs, your eyes, and your kidney, you cause all these symptoms, diseases, like Dr. Levy expressed very so elegantly, that clinical manifestations of diseases, they all have very similar root causes. That's why in an earlier paper, I categorized them into 10 categories. Toxins is the on top. Infection is part of the toxins as well. So if we look at it systematically, actually, diseases can be prevented and managed regardless. So we should focus less on disease specifics or the mechanism, more on the root causes, as Dr. Tom just mentioned so eloquently. Again, oxidative stress is the key part of all these mechanisms. Any other questions here?
Somebody asked about methylene blue. Do I recommend it? I recommend it highly. Okay.
Oh, I take it every day.
For anybody that wants to send me an email, I'll send you a document that I call my Super 8 supplements. Quite simply, they're with the addition of cortisol for the vitamin C. That's another story. I told you cortisol improves vitamin C delivery to the cells, but you have 4 ones that normalize calcium metabolism. That's vitamin C, magnesium, vitamin D, vitamin K2. And then you have 4 others that optimize ATP production. That's niacinamide, riboflavin, coenzyme Q10, and methylene blue. by stimulating the electron transport system inside the mitochondria. You take all of those together, I have just seen marvelous improvements in just about any condition you can imagine, because they go to all the cells of the body, and whatever cells are involved in whatever clinical problem or disease process you're going on, guess what? It gets better. I've seen sudden deafness disappear, all sort of other disorders just completely improve. I will say, though, that there's one additional that it's not on there, so I now call it the Super 8+1, and that is olive leaf extract that has hydroxytyrosol in it, which, believe it or not, has been shown to help reverse or completely reverse, depending on the patient, the inability of the fourth enzyme in the liver to convert glucose into vitamin C. We're all basically vitamin C deficient mutants, but when all the enzymes start working and we make our own vitamin C, then everything else gets better.
Tom, that's another great topic that we should pick up and continue to talk. Yeah. And I see one relevant question here. 417 Integrative asks, how many treatments on average does it take to see improvements with spike protein disease pathology with UBI?
One.
Just one.
Just one. But
3 minutes.
if you don't get your optimal improvement, you go a week later with another one, and then a week later with the third one. But Dr. Lau got enormous improvement, and you got to remember too, when people want to know, how do you know the permanence of this resolution? Well, Dr. Lau works in a small Swiss village, okay, sort of a general practice type scenario. Now, if you come in feeling lousy with whatever your chronic COVID symptoms are, and you get the treatment and you feel great, and then you say, well, I wonder if that treatment caused it to be a permanent result. Well, in a small town, they're going to come back if they feel bad again. And these people don't come back. So again, you have limitations in a small practice as to whether or not you're going to generate a quality study. But the point of the matter is, if you're a sick person in a small town and you get a whole lot better, but then you start getting worse again, guess what? You come back, and they don't come back.
So, Tom, I got a question for you. Basically, you believe this UBI treatment is targeting the spike protein per se, not necessarily the D-dimer. So the real question is the elevated D-dimer, which is pretty common, the hypercoagulability in many middle-aged or older people with chronic diseases, particularly ASCVD type. So my question really is, would you venture to maybe propose that this might work on other hypercoagulopathies, basically?
I have no doubt. The only different thing here is if you have a D-dimer elevated because you have a cancer, well, you're not necessarily, if you don't resolve the cancer, you're not going to resolve the reason why the D-dimer is elevated.
Yeah. Mm-hmm.
Okay, but within those confines, you have any sort of hypercoagulable. And the other thing too is it's an inexpensive machine. It's a simple procedure to do. There's so many other much more complicated, much more expensive, much more long-term type things that we do multiple times. This is something that can be done, especially in a small town practice, as often as is deemed necessary. Although for the case of long COVID, it doesn't have to be done frequently. For myself, I've got my own machine set up. I haven't gotten everything else done yet, but I plan personally, once I get everything settled, to give myself a treatment every couple months. I mean, I'm 75 and feeling fine, but I also just told you, when you go down with anything, part of the formula is a diminished perfusion and microcirculation. Those decrease your oxygenation, increase your oxidative stress to everything. So, a matter of fact, I think diminished blood flow, for whatever reason, is a primary pathophysiological reason for the evolution of any disease. This doesn't nullify what I said about oxidative stress, because when you diminish blood flow to a tissue, you diminish the oxygen and you increase the oxidative stress because more biomolecules get oxidized as a result.
And also this UVC, UVC, do you think that target the pathogens as well, the virus, virus?
I got to be honest. People who are extremely scientific don't like this response at all, but the answer is it's magic. I don't know what this does, but there are some docs that don't like to use something unless they really think they know what they're doing. Well, guess what? This causes no harm and it resolves a clinical situation completely. So I'm going to recommend using it if and until and if ever we actually figure out the mechanism. Now, they do talk in the literature about ultraviolet light possibly stimulating the immune system, this sort of thing. Well, guess what? A lot of these people feel fantastic immediately after the first treatment. That can't be an immune response. I mean, it might give you a better, more complete response down the road, but for many of these patients, the clinical benefit is realized immediately.
Yeah, because
just like Dr. Volz, when the infected tooth come out, boom, they feel great right away. Same thing with this treatment.
Yeah, because this might have very significant clinical impact because chronic viremia or chronic infections, the latent infections, we see so common. And as our next speaker, Coco, will talk about for example, HPV infections and hepatitis B infections, EB viral infections. These are all very, one of the major root drivers of all diseases. And hopefully this could shed some light, the UBI treatment on these conditions, And it's quite exciting. Yeah.
Some people are asking about the ebook. I want to repeat, I'll give you the ebook for free. And at the end of the presentation is my email address. So TELevyMD@yahoo.com. Send me an email. I'll send you the PDF.
Yeah. Thank you so much. And it's getting late there. And there are many other questions in our chat room and here too. But you may continue to post those questions to also Molecular Medicine or on the Substack where we'll try to address those questions.
Okay.
Thank you again, Dr. Levy.
Right. I'll be leaving now. Thank you very much.
Okay. One more thing I want to add. I think Ms. Wang is here. I'm very glad to sort of announce or make it known, particularly to our Chinese audience here, that we've got a great collaboration happening very soon, where we will be focusing on cancer, ASCVD, and the way we just talked about long COVID. And Tom, and we are going to have a major conference on cancer next month, and I'd like you to talk there again.
Okay.
Right. Thank you all so much. And in honor it's late, you're welcome to stay on. But if not, let's switch the gear over to Coco. Are you ready?
Ready.
Okay. Yeah. Oh yes, please. You have the on the here. These are from the here. Okay. All right. So one of the questions is, other than UV, is Tom still there? Is he gone? Tom, are you still there? The question is, other than UV, any other measures to decrease D-dimers? Now, before Tom takes a shot at that, let me answer that briefly. Is basically elevated D-dimer is part of the elevated oxidative stress. So antioxidants, for example, vitamin C itself will decrease the hypercoagulability. Yes, it can decrease the hypercoagulability. But anyway, Tom, your answer to this?
Well, things like the nattokinase and these other thrombolytics do appear to have a positive effect. And I think they should be a part of most people's supplement regimen if it's affordable. But this appears to be a much more definitive intervention. Okay, so but I think some people too seem more susceptible to casual contact with spike protein than others. So that's still a good thing to have circulating in your system at the time when you get a low-grade spike protein exposure by casual contact.
Yeah, I want to add here is that again, please, everybody, do not We recommend the integrative systemic approach, not just one. And for any, for example, the COVID-19, the UBI system, we need to live a healthy diet. I mean, eat a healthy diet, live a healthy lifestyle, and nutrition, and everything else. If I have time, I'm gonna talk briefly about integrative and systemic medicine later. But don't, we are definitely not advising single agent, single approach to any disease management, basically. Yeah. All right. So do we have another question here? Okay, that's well, I think that's good enough. We can answer the other question. Now let's, Coco, are you ready? Okay, so let me give you a little bit brief introduction as it's getting late over there on the Western atmosphere. Where do I have it? Anyway, the phone here. So when you're getting ready, so well, Carolina Volz, Coco Volz, she goes by that. She is a member of the International Circle for Biological Society. She is a young lady, young, beautiful lady. And at this age, she's so aware of health. I'm so glad. I wish my children were so concerned about health as well as she is. And she's also very dedicated, very energetic, and very much like her father, very much into integrative and systemic medicine. So thank you again for traveling the great distance from Uruguay to Zurich nonstop and to Shanghai for this face-to-face integrative systemic medicine conversation. Now you have the platform. Go ahead, please. Yeah.
Okay, so welcome to my presentation on the female cycle as a vital sign. I'm very honored to be here today and to present this topic because it's close to my heart. And I had my own health journey. I'm still on this journey. And I want to start my presentation though by thanking you, Dr. Cheng, for inviting me here to Shanghai. And I'm here for two reasons. First of all, to share some thoughts with you. And second, I'm here as a student to deepen my understanding of my own health. And I'm very much looking forward to do this next 4 days with you. Mm-hmm. So I'm going to talk about a topic today that affects half of the population. In the Western world, we grew up learning that the menstrual cycle or the menstruation is something very annoying, and it ruins our beach vacation and it puts the strains on our skirt, and we just learn to suppress it, and the doctors say just take a pill and then it's all being managed. However, being here in China, I'm very humble and very aware that the Eastern medicine differs from the Western medicine, and traditional Chinese medicine is actually understanding the cyclical nature of a female body, and is understanding that women are not like machines and we can't function every day the same way, but our bodies are more like gardens going through different seasons, which I will talk about more a bit later. So I believe the Western medicine can learn a lot from traditional Chinese medicine approaches when it comes to female health. So let's have a look at the fifth vital sign. In Western medicine, we measure the vitality, which is the life force of a human being, by 4 signs. It's the heart rate, it's the respiratory rate, it's the blood pressure, and it's the body temperature. However, and this is very interesting, in 2015, some major official societies, such as the American College of Obstetricians and Gynecologists, have officially defined the menstrual cycle as a 5th vital sign, which means we women, we actually have an advantage over men, because we don't only have 4 indicators of health, but we have 5. Yet, how often is this 5th sign of vitality being ignored? In Western medicine, if a patient goes to a doctor because of high blood pressure, he gets a treatment plan, it's taken very serious. But if young women go to a doctor because of irregular cycles or PMSing or hormones that are off, the doctor says, don't worry, you're overreacting, it's normal, take a pill. So unfortunately, the truth is that the cycle is not just a fertility calendar, but it's a medical health indicator. And when we use it as a navigator, then we as women can actually get to where we want to come. But we have to use it as a navigator, and we have to look closely and use this fifth vital sign. So let's talk about these 4 seasons of the cycle. So menstruation equals winter phase. It's a time of releasing, it's a time of resting. It's basically yin energy when we talk about traditional Chinese medicine. And the follicular phase is when we move into spring. It's when our creativity blooms, when we slowly start to build up for the ovulation and we have more energy, we feel more outgoing. And then we arrive at ovulation, which is the summer. It's the peak of our energy. It's the young energy. And we have a lot of power and we're very communicative. This is the state when we should do difficult meetings, difficult projects, when we should have difficult conversations, maybe with our partner or with our friends or whoever. We are most powerful in the ovulation phase for things like this. Then we come to luteal phase, which is the autumn phase. It's really a phase of resting. We don't want to be in the in a flight mode. We want to be in the rest and digest mode. We want to keep cortisol low. We want to give our body the time to prepare for winter again.
Quite interesting. Never thought this way.
Yeah, the seasons. So why does this matter for lifestyle? It's very simple. So when you run a summer program, so if you run a summer diet or a summer workout plan in the phase of winter, you're working against your body. So let me show you this in a better example. So let's talk about follicular phase, spring. We have higher insulin sensitivity. So a keto diet or low carb is perfect. It's great. And low blood sugars increases estrogen, which we need in this phase. So estrogen thrives when blood sugar is very, very low. So we can do a workout, we can push, we can do intermittent fasting, we can do a little cold plunge here and there, some sauna. However, in the luteal phase, in the autumn phase, keto, low carb, strict fasting, all of these things are all stressors. So they can spike cortisol. And when cortisol is high, progesterone, which is the hormone we need in this phase, is going to stay low. And we won't have the benefits of the luteal phase, and our hormones will be off. So it's really important that we respect these kind of rules as a woman. And we have to make sure we behave different, we eat different, we work out different, we have a totally different lifestyle in our different cycles, menstrual phases.
Mm-hmm.
However, when talking about hormonal balance, I have to mention systemic health and I have to mention oral health, because inflammation in the mouth equals inflammation in the entire body. And that leads to hormonal imbalance. And this is where the expertise of my dad and Dr. Cheng comes in. And we heard already a little bit today, and I hope we will hear also something from you later on. And because this whole topic is very close to my heart, together with my dad, I'm writing a book. It's called The Longevity Fast Track Guide, because my dad, he loves longevity. And I said, but hold on, wait a minute. If women read our book or read the book, they do the same than men. And that's not good, because we cannot fast every day of the month. And we cannot do cold plunges every day. No, we have to work in a cyclically. So I said, okay, we'll do it this way. You write all your chapters and you put all your knowledge into the book. And I write it in the book. Always at the end of the chapter, I write how women have to adjust and how they need to use the same tools in a different way. So yeah, the book will come out this year. I'm very happy to share it with you. We're also, Dr. Cheng and I've been talking about it, so we will share it with you for sure. And yes, that's already my presentation. Your cycle is not an obstacle to your goals. It is an inner compass. And if we use it as an inner compass, we will feel much better. And I'm on my way. I'm on my journey to this. So thank you very much.
Wow, what a fascinating talk.
Thank you.
Very concise. And you put it in a way I've never heard before, but it makes so perfect sense. This is great. And I think, particularly here in the low carb, people can hear, low carb ketogenic diet, because how we apply this to women, it poses a real serious challenge, as we know. Many people go on low carb, particularly ketogenic, many women, their hormone, the cycles get disrupted.
Exactly.
And it's very, very challenging, And, for example, I always, one way we know about this is that, think about it. The way I think about it is that, men and women have been around for a long, long time, way before agriculture showed up about 10,000 years ago. So what did the women eat at that time? Mostly still, women, well, they were probably less of a hunter, but they eat what the men hunted, right? But so I guess at that time, probably they also followed some sort of like a cycle like this. So this is really very interesting. And I'd like to hear more from you. Maybe we should dive more specifically in the, in a more biochemical, hormonal, and chronological way.
Yes,
Maybe
I would
writing
love to.
papers.
There's so more to tell and so
Yeah,
much more to talk about.
Yeah, because we shouldn't treat. And I was even thinking about men. Yes, well, this is a little bit off the topic. Women already have enough advantage, in my view. What I'm gonna say is that, do men have also a fifth sign? I mean, don't we go through cycles? We have menopause. Men have, andropause too. But anyway, that's a little bit
Yes.
different thing. But this is a great angle and really, eye-opening. Great. Thank you so much.
Thank you so
And
much.
again, thank you for traveling a great distance from, this is the longest trip ever
Pleasure
of
to be
coming
here.
over with us. Yeah. All right, let's see if we have any questions here. Any questions from the Tencent? And also let's see if any questions from the, yeah. Oh, well, yeah, okay. All right. Okay, without any other questions, maybe I will just give a little bit, because I saw today we primarily asked our guests to talk, but now what is that, right? It's 11:30. Okay, a few minutes. I will just give a very brief overview to sort of supplement. Okay, can I share my slides here? Okay.
Yes.
Okay. All right. I will just give a quick overview. It's getting very late in the Western Hemisphere. And so, as a clinician, I've been always interested in how we can manage health, help patient, help myself. I always say, for myself, I want to live a healthy, happy, and hopefully longer life. Healthy, happy, I know today. Longer, well, it's up to God, okay? So anyway, I call it, so basically my approach is based in also molecular medicine, but integrating other things we're learning. Okay, yeah. All right, so basically the way I see it is, first of all, I'm getting old. I'm 66 today, and so I want to live a healthy and a happy and a longer life. And also, my parents are in their 90s right now, so I want to learn everything there is to keep myself, my loved ones, hopefully my friends and my fans healthy and happy. So that's where the motivation is. And I'm going to share some brief ones here. But again, it is, we know everybody in this world is trying to influence somebody else, whether it's political, medicine, business, whatever. So the idea here is how we can cut through the chase and the chase to the, to the bottom, to the root causes. So what I call it is also basically root cause focused, patient-centric, okay? And, I don't mind making money, but making profit should come second. So that's the idea. Well, this is myself and standard. I don't, okay. So basically, briefly, the conventional medicine focuses on the clinical manifestations and also mostly mechanisms. And what I believe we should really focus on are the root causes. So the distinction changes everything. Symptoms are signals, mechanisms are pathways. That's very important we have to realize. Because in functional medicine, in other alternative medicines, I still see a lot of doctors focusing on mechanisms, not root causes. I'm not saying mechanisms are not important. Mechanisms are helping us to understand how diseases happen. And we should also target the mechanisms and treat clinical symptoms, but we shouldn't stop there. We should always go to the root causes. Root causes are the drivers. So integrative orthomolecular medicine, or IOM, focuses on drivers. That's the key message. And in a recent paper, I summarized, and anybody who wants to share, I mean, if you have any other opinion, let me know. But these are the 10 categories that I really dived into, and I think I can come up with these 10 distinctives. There are some overlapping, but I think these are pretty comprehensive. I can't think of any. Basically, this is a framework of all the root drivers. They fall into one of these 10 categories. If you know any more, let me know. So I published it as a paper here. Let me go over briefly. The framework here serves a primary purpose. So basically for us as practitioners or as a consumer, we no longer sort of haphazardly or randomly looking for how we can manage disease, and here's a magic tool, there is a magic pill, but we put in the systemic way. So the framework here is for us to think through. Doesn't mean everybody has all these 10 categories of issues, but that this is the framework, and for clinician as well. So briefly, first of all, are the toxins. I already mentioned it. There are 2 recent papers, very typical. One paper published in Lancet 2023, I believe, basically finds 16% number 1 cause of mortality globally are the toxins. Okay, 16% of all total mortality worldwide are directly contributable to toxins. The toxins are the number 1. Again, we cannot overemphasize, very important, as we focused today by Dr. Volz, Dr. Levy, and Coco mentioned as well. And the second is the micronutrient deficiencies. These are very rampant, very major pandemic, okay? And particularly vitamin C, vitamin D, magnesium, to name just a few. I think Dr. Tom Levy mentioned the number, with a magic A+1. So we all have all these, very common, okay? So we all have our magic few top ones. I mean, we share the similar stuff. Number 3, lifestyle behavior risk factors, very important. We know that goes without saying. Many people already know that. And dietary, we listed it as a separate one. This is very critical. Many people already mentioned, Coco mentioned earlier, like a low-carb ketogenic diet. Yes, that's one major one there. And chronic infections we touched on today. This is very critical. Everything, chronic infections, the most probably are the major ones, but also other I mentioned a little bit earlier, because this is very rampant. Chronic viral infections, HPV, hepatitis B, EB, and all these things, they hurt us. And the psychological, emotional stress, hormonal imbalance, what today we mentioned a little bit. Hormonal imbalance, actually, they serve both as, in my view, a root driver, also as a mechanism. For example, menopause is poor, the normal menopause for women is more of like a root driver, because that's the primary. But there are also hormonal imbalance as secondary, as mechanisms, for example, by the endocrine disrupting chemicals or unhealthy lifestyle. So in those instances, hormonal imbalance acts as a mechanism leading to clinical manifestations. And number 8, developmental and early life programming. Basically, how a baby is raised. For example, we know these formulas or the way how baby is delivered, these all have a major impact. Some of these impacts can be lifelong. I didn't know this. For example, it's good to know that if a newborn baby is deficient or insufficient vitamin C, these deficiencies can have lifelong impact. One thing is, this is in the literature, is that low vitamin C causes structural damage in the brain, believe it or not. And these structural damage, for example, in the hippocampus. And we know hippocampus is directly responsible for memory. And so if you are low in vitamin C in the first 3 months, maybe years, you may have long-term IQ issues. Yeah. So these are critical. And but of course, for an adult, the early developmental and early programming may be less important because it's gone and it's over. And number 9, genetic and epigenetic susceptibility. Genetic is important. It's, however, whatever genes you inherit from your parents are done. There's nothing you can do about. Epigenetic is more important because our behavior, our nutrition, and our toxin exposure impact on the epigenetic expression. Okay. Then number 10 is very critical to everybody, medical iatrogenics. Genesis, basically, you take a lot of antibiotics, you are exposed to too many, for example, x-rays or CT exams, those can harm yourself. Okay, we all know that. Basically, this is the framework, hopefully, that we realize we can, go through, see what problems you may have. Okay, and so again, like I mentioned, IOM is root cause focused, patient-centric, and it's not disease-centered because, that's why we see a lot. When we use this approach to manage patients, we see many diseases improve or disappear with the same approach. And in Chinese medicine, there's because they refresh my memory, they call it the 医病同治, basically same treatment, different diseases. Why? Because we are targeting the same root drivers. As Lizzie, you don't mind me talking about, right? Her mom is a great example. Her mom, I told her Coco about you. She's so passionate with because 3 years ago, 4 years ago. Let me talk a little bit. Lizzie's mom is 60-some years old, fine lady, diagnosed of coronary artery stenosis. Was that 70% or 75% stenosis? So yeah, Lizzie was didn't want the statins, didn't want the the stents. So she searched, and luckily she found me on the internet, and she came to us. And within 2 years exactly, that I remember was June of 2022, with 70 to 75% stenosis, the most severe. And within 2 years, completely resolved, non-detectable by CTA, the CT angiogram. Okay, completely dissolved on the CT. And so, I mean, we have reported this on also medical medicine. We have another case of complete resolution prior to that case. We have 8 other cases of on their way to complete resolution, but anyway, significant improvement. And more interesting, I want to say, is that Lizzie's mom not only noticed the complete reversal of her coronary stenosis, but also the complete resolution of, I think it's the lung nodules. Because she also had thyroid nodules and lung nodules. And I think the lung nodules are completely gone, thyroid nodules reduced in size, or maybe the other way. That's right? Yeah. And very strikingly, we had a picture to show as well. I'm not showing today. It's reported on the also American Medicine News Service 2 years ago. Yeah, 2024. And basically, she had we didn't notice earlier. Anyway, she noticed she had a sort of, we call it solar lentigens on the face, on the left cheek, very significant, very clear. They later on realized that's gone. We had a picture, and recently you showed us a picture completely gone. So take another picture, we need to update that. So basically, we didn't do, she came here for coronary stenosis, not for lung nodules, not for thyroid nodules, not for the we call it aging spot. But those things all either completely resolved or significantly improved. Why? Because we targeted the root drivers. The root drivers, whether it's Alzheimer's, cancer, or atherosclerosis or aging spot, they're pretty much the same in those 10 categories. Okay, that's the idea. So basically, IOM is not disease-centered, it is system-centered. It is biochemical, and of course, takes into the account of biochemical individuality, systems regulation, terrain optimization, basically a whole body, and the patient before protocol. That's important. Okay, so for those, most of you know about orthomolecular, but in case you don't, orthomolecular meaning optimal molecular environment, seed and soil. When we treat diseases, don't focus on disease only. Look at the whole body, okay? Like when you have excellent seed, but when the soil is bad, I'm sorry, it doesn't grow. You can drop the best seed you have on the cement, concrete. It doesn't work. It doesn't grow, right? So ortho means correct or right. Molecule, that biochemical precision. So right molecule, right dose, this is critical. Right combination, I'm going to talk a little bit more later. Right patient, that's orthomolecular medicine. Okay? Again, we already talked about root cause versus mechanism or clinical manifestation. So conventional model and IOM model, okay? So conventional model prevent deficiency. Here's the key. Orthomolecular medicine differs from conventional medicine and also differs from other alternative medicine, for example, functional medicine. In orthomolecular medicine, we use vitamins, micronutrients as therapeutics. We are not using these to simply to supplement for deficiency or insufficiency. We are using on top of far above and beyond. We use high dose, for example, high dose vitamin C, high dose vitamin D as a treatment. Okay, that's one major difference. Many others, including most conventional functional medicine doctors, view it as supplementation for deficiency correction. No, we go beyond that. Okay, and also conventional medicine is basically primarily RDA level dosing, and we already mentioned we are talking about physiological therapeutic dosing, and we are optimizing cellular function, and we are another thing is the synergy, teamwork, and most doctors they are we've been brainwashed. Brainwashed by conventional medicine using usually single approach. And many of us too, including, if you don't mind, Coco, I mentioned that, a lot of us using these single nutritional supplements. And also molecular medicine is not about that. Integrative also molecular medicine is about integrative teamwork, network synergy, okay? And so we're not supplement to single nutrition, okay, nutrient. Okay. Again, conventional medicine commonly target. Here's a list of common mechanisms. Just go quickly. I'm not going to go into the detail. Basically, conventional medicine targets the mechanisms, including some of the functional medicine today I want to mention too is, for example, I hear people talking all the, about leaky gut and the probiotics. Probiotics are important, but don't forget probiotics or leaky gut is primarily a mechanism. It is not a root driver because leaky gut doesn't happen naturally. It is caused by poor diet, caused by the toxins, including antibiotic use in our diet. And so therefore, they are a clinical manifestation. They are a mechanism. You got to work at the root driver. And normal people, healthy people don't need probiotic, but healthy people still need to supplement vitamins. Okay, that's the key difference. So we need to think systematically. So synergy is another thing I want to mention here. That's, again, it separates also integrative molecular medicine from others is because these vitamins, they work in synergism, they work in teamwork. For example, let's just focus on vitamin C. We know vitamin C is a water-soluble antioxidant. We know vitamin E is a lipid-soluble antioxidant. So vitamin E, when we take vitamin E sits on top of the cellular membrane, okay? It protects, we know cellular membrane are mostly lipids, and a lot of these important proteins and other structures on the membrane. So when an oxidant, as Dr. Levy mentioned, oxidants come in, they grab electrons from the environment. And so when for example, COVID-19, yes, it is an oxidant, it's a toxin. When it comes in, it oxidizes these lipids on our cell membrane. The first molecule to rescue the lipid oxidized, the oxidized lipid is vitamin E. Vitamin E is lipid soluble. So vitamin E contributes an electron to the oxidized lipid to rescue the bowel important lipid, and vitamin E itself is oxidized. Well, here comes in vitamin C. Vitamin C comes in to donate electron to rescue that vitamin E. This is very critical. Several studies in the literature clearly demonstrate that without vitamin C or vitamin E, this oxidative reduction, this change doesn't work, doesn't happen. Okay. Without vitamin C, vitamin E's antioxidant capacity doesn't show. They work in system. Okay, synergy, important. Okay, so of course, vitamin C passes down, it gets rescued again eventually by the glutathione. It's a teamwork. So we think about teamwork, don't think about single nutrition supplement. Why do I mention that correctly? Is because, again, like I mentioned, so many people on the market, some of them are well-meaning. They want to help you. They want to sell you some antioxidants. However, we have to understand that these nutrients, they come in synergism. Taking one nutrient usually doesn't work. You need a system, you need a teamwork, okay? So that's important. All right, and here comes in another way I look at it is that we have so many products on the market, right? Like I mentioned, I was talking to Coco, I said, here, because we don't have good enough supplements on the market that satisfy my satisfaction. So therefore, I have been developing these on my own. Early on, when I did it, I was trying to take it for myself, for my parents, okay? The idea is that, we have these things available to me. It's not a cost issue. Even given that, I'm not able to take all these supplements that I have, but too much. Why is that? It's because too much. So here comes a very important question is, how do we, what nutritional supplements do we need? Okay, so basically I divide them into essential and non-essential nutrients. What are the essential? Very critically, all the vitamins. By definition, why are vitamins called vitamins? In Chinese or in English, they are life essential. Without these vitamins, our life simply doesn't function, doesn't work. We may die. We know that. Okay. So, for example, if we don't have vitamin C, we all know we have scurvy. Once severe enough, we'll die. Okay. Vitamin D is the same. We don't have to go. Everybody here listening in the audience, I'm sure they were all aware. We have a pandemic level of insufficiency and the deficiency of these vitamins and micronutrients. Okay. So all the vitamins and essential minerals include particularly magnesium, zinc, copper, these things. These are the critical nutrients, okay? So I don't care what you are proposing or you're peddling, you are promoting. Or if you're a consumer, I don't mind, or I don't really care if you want to take this or that. However, you got to cover your bases, the foundations. I think I have a slide here later on. You cover your foundations. You got to live a healthy lifestyle. You got to eat your healthy diet. You got to supplement, making sure you have the foundation covered. That includes all the vitamins, essential minerals, and mitochondria essential nutrients. That's what I mean. If you get that covered, you can add anything else. For example, people here in China always ask me, what do you think about molecular hydrogen? Right? I said, sure, that's great. But the question I really ask is, is molecular hydrogen an essential nutrition? That's the question, right? Is it an essential nutrient? So the question I think about it is that think today and also historically, are there any ways that making us to be deficient or insufficient of that nutrition, of a nutrient, for example, the molecular hydrogen? Why do I think that way? For example, vitamin D. Why are modern people so insufficient or deficient of vitamin D? Is because ancient people, they live outdoors. They, run in the sun. They get a lot of sun exposure. Today, I always say we are, in high rises, we're suited up, we look fancy, we forget we're animals. Animals, we get sunshine. I mean, most animals, they get sun exposure. We don't. And vitamin D is a great example because we know it's a sunshine vitamin. If you don't get sunshine, you don't get vitamin D, period, unless you supplement it. This principle actually applies to practically all other vitamins, essential nutrients. So if you think that way, today, why are we deficient or insufficient of vitamin C? It's because we are eating more ultra-processed foods. Foods are no longer as fresh. We know vitamin C in particular, they degrade when the foods are in the refrigerator or in the transportation, en route in transportation. Therefore, we don't get enough intake of these vitamin C, for example. We don't eat fresh foods, fresh meats, fresh vegetables, or fresh foods. That's why we have also our soil is degraded. We know that. Our soil is no longer as nutrient rich as used to be. That's why we need supplementation, okay? I can't think of a way why we would be short of or deficient of molecular hydrogen. So my conclusion right now on this is that I do not think molecular hydrogen is an essential nutrient, unless you know something that I don't. I like to learn. I'm always open. So right now, I classify molecular hydrogen as a non-essential nutrient. Sure, you're welcome to try it, but make sure you get your base covered. That's my philosophy. You get your vitamin C, D, magnesium cover, you do anything you want. But don't put the cart ahead of your horse. Don't take a stem cell expensive. Expensive doesn't mean good quality, doesn't mean good health. You miss this healthy diet, you don't get the nutrition supplement, no matter how many stem cell transfusions you get, you are not getting the full potential of it. That's my message. Okay. So I am key features. Okay. The key features again is root driver analysis, redox balance optimization, barrier integrity preservation. I mentioned earlier. So in order to have optimum health, you got to have the healthy gut, no leaky gut. How to prevent Alzheimer's? First of all, protect your blood-brain barrier. How do we do that? Optimize the nutrition, minimize your toxin exposure, the two basic ones, right? Mitochondrial support, individualized dosing, system level regulation. Okay, so here, this is a summary. On the left, I'm not going to read, it's getting late. Basically, my diet, again, many people know I recommend a healthy diet. Healthy diet to me is low carb for sure. Also, minimize your ultra-processed foods, okay? And also, ideally, I would recommend intermittent ketogenic diet, like Coco mentioned, cycle-based diet. Maybe men, we should also have cycle. We want to be equal, right? Men, women equal. Yeah. It's the men's turn to fight for equal. And intermittent fasting, okay? And healthy lifestyle. Also molecular nutrient, whether it's the magic 8 or magic 10. But here's my list of the essential micronutrients and toxins. Minimize toxin exposure and detox, that's important as well. And if you detect hormonal imbalance, fix your hormonal imbalance. And also on top of that, you can have other fancier things, including we mentioned a little bit about methylene blue, or what I call it red-blue therapy, and light therapy, basically near infrared and the red light therapy, and also methylene blue. One is red. I do it every day, and most people know me. I always sit under, near infrared light. And the other like the cellular therapy and stem therapy or other advanced biologicals. So what I'm saying is there's the sequence. Start from the very foundation, and the foundational ones are basic ones, oftentimes are free. For example, teaching a lot of diet, you don't get a penny, but that's foundation, that's very important. And if you can do all these things, I'm giving you start very basic ones. If you haven't started, I'm advising everybody in the audience, if you haven't started, start with your low carb, whole food diet, eliminate ultra processed food, definitely start intermittent fasting and supplement with the very basic ones. Vitamin C, maybe 3 grams or more. Vitamin D3, 5,000 units a day. Yes, don't worry about it. It's very safe. Magnesium, if you take vitamin glycerin, for example, at least 500 milligram a day. I take like up to 2,500 milligram. Zinc, 15 to 30. And vitamin K2, at least I take 45 milligram. But we recommend at least 0.2 milligram a day. If you don't take others, take these. I tell you, within a few weeks, you'll feel better. Anyway, so I stop here because it's getting late over there and getting long. Thank you so much for everybody, particularly for Coco, traveling long distance again. Okay, let's see if we have any. It's already 12. We can entertain a few questions, maybe 2. Yeah, which question? Which question? Okay, let me see here. Let me see, go back to the Zoom, because in the Western Hemisphere, in the United States, getting late there. Okay, let me just briefly mention this. It's same about vitamin C here. Okay, about liposomal vitamin C. I think I see a few questions about liposomal vitamin C, of the forms of vitamin C. Basically, vitamin C, in my view, comes in primarily three forms. Oral form comes in whether vitamin C powder or tablet. I prefer powder, pure powder, because to make vitamin C, again, we are advising high doses. And if we take high doses in tablet form, tablet form, vitamin C, they don't stick together. You have to have fillers. You basically glue. These are junks, okay? So I advise pure, high purity vitamin C. So I always use 99.5% or higher vitamin C, the one we use, okay? So pure vitamin C. Liposomal vitamin C, the key advantage there is that it improves the absorption. Basically, if you take vitamin C powder, theory is that you can absorb up to 1 gram per hour. Okay, so even if you take around the clock, the maximum you can get is 24 grams a day. For most people, that's fine. But for cancer or a few acute severe infections, we oftentimes go to 50, 60 grams a day, or even 200, 300 grams a day. Then that requires IV vitamin, okay? And liposomal vitamin C gives you better absorption. The absorption rate there is between oral and IV vitamin C, okay? I studied a lot into this. We were hoping to develop a liposomal vitamin C that can replace IV, but so far that doesn't seem to be possible. And for very high doses like cancer, you still need IV right now. Okay, so that's about the vitamin C. And for most people, in my view, oral vitamin C is fine, vitamin C powder. So basically what I do is I have a 5-gram vitamin C water on my bedside. So before I go to bed, I drink half of it. And at midnight, if I wake up, usually I don't, but if I wake up, I may have a few sips. In the morning, when I wake up, I finish it, and during the day, in the morning, I have another one. Usually, I take 10 to 15 grams a day. Okay, that's about vitamin C. Also, you mentioned that in the 10 center, there's a question here, right? Okay, let me see. Okay. Okay, this is Groot. Okay. Oh, okay. So the question here is about GSH, glutamine, and IV vitamin C. The question actually, let's see, IV vitamin C 50 grams, and she's asking about giving glutathione together. Actually, I answered the question in our previous podcast. I don't really recommend to use vitamin C, IV vitamin C, and glutathione together because IV vitamin C, IV vitamin C, I see probably 3 levels of dosing. One is probably usually about 20 to 30 grams IV vitamin C. That's primarily for collagen boost, so to speak. And another level is probably between 50 to 60 gram level, which is more for like severe infections. And a higher level is for cancer, like we mentioned. NIH website shows you can go up to 1.5 or even 2 grams per kilogram. That goes to probably 100, 200 grams a day. Some people even go to even higher. So IV vitamin C oftentimes has a mixed antioxidant and the pro-oxidant features, okay? And the glutathione we know is powerful, the biggest intracellular antioxidant. So when you administer glutathione and vitamin C together, so basically glutathione neutralizes the pro-oxidants feature of vitamin C. And if the purpose of IV vitamin C is for pro-oxidant to kill bacterial or viral laden cells or cancer cells, probably you would do a disservice by administering glutathione together. So now usually I've been doing 20 grams of vitamin C to my parents, to myself. And last November in the Riordan Clinic, we had this IV vitamin C infusion before the conference. We had a little conversation. So at that time, we got 50 grams. The idea there is that get 50 grams, we were all apparently normal, okay? I mean, Dr. Levy, Dr. Riordan, Honey Hackey, myself, and a few others. So the idea there is that when you get a higher dose for like 50 grams to a normal person, so you get a super physiological, peak of vitamin C. That probably works as an, pro-oxidant. And that's here actually there's another question is when you have that high super physiological level for normal people, in theory, that may be able to kill off some of these senile, old cells, because we know older cells, aging cells, usually have higher level of iron in them. Iron laden, basically ferroptosis. Iron metabolism is a little bit impaired in aging cells, in cancer cells, in also infected cells. So that's a major reason why high dose vitamin C can kill these abnormal cells. This is an interesting investigation for future. High dose vitamin C may be able to assist in anti-aging. Okay, so for that purpose, I would not recommend the glutathione together. I would rather, again, like I said, glutathione we can take by mouth. Liposomal glutathione or Glynac. So that's the answer to that question. Any other questions? Okay, is Coco here? Tai has a question. Coco, Tai has a question for Coco. Will her writing on the subject of menstruation as a vital marker for women be expanded into clinical examples and application?
Hopefully. Yes, so it would be absolutely amazing to expand it into clinical examples and application. That's definitely something for the future. For now, I'm not a doctor myself. It's only I stopped taking the pill 2 years ago, and I had quite some challenges with my health, and I had bad skin problems and felt hormonal imbalances in so many different aspects of my life and of my body. And so I started to dive deep into female health, and this is only the beginning. So yeah, hopefully in the future we will have clinical applications and examples.
Yes, again, that's a very great area to dive in to look at it scientifically. Maybe we should even work on the scientific papers.
Yes, I would love to.
Yeah, this is very exciting
Yeah.
area. And again, I like to add, since this subject came up, in my career of actually, I've been in medicine for 50 years. I can't believe it, Anyway, so I've seen multiple cases of a young woman walking to my clinic complaining of chest pain. First thing I think of is the birth control pill induced thrombosis. I've seen multiple cases,
Yes.
So I'm definitely against the conventional birth control pills. They are bad. They should be, I think they should be banned.
Forbidden.
They should be
Yes,
forbidden,
I agree.
unfortunately. Yeah. Okay, let's see.
Thank you.
Thank you. All right, it's getting late. Thank you again. If you have any other questions, here is one question. That's important. Okay, this is from Varsha Manik. Her Varsha, that sounds like a woman. What is your opinion on vitamin C enemas? Actually, this is interesting. I was talking to Coco yesterday. Basically, I don't recommend it. The reason for that is I recommend more of vitamin C flush, simply for convenience reasons. Okay, so basically we know vitamin C is a small molecule, and when you take vitamin C powder, it has to be powder. When you take a lot of vitamin C powder, it goes into our gut, and particularly when it goes into our large intestines, due to the osmosis, it attracts a lot of water molecules from the extra-intestinal tissues, and so it swells up the colon and causes the flush. Okay, so when you have vitamin C flush, basically it shows a couple of things. One is that your gut is saturated with vitamin C. Or high dose vitamin C, it neutralizes, detoxifies whatever toxins in the gut. So oral vitamin C always has a purpose that's different from IV vitamin C. So when you take IV vitamin C, also this is probably a good quality liposomal vitamin C doesn't have, because of good quality liposomal vitamin C gets practically absorbed 100%. So it doesn't have the GI effect of vitamin C powder. And so when you have vitamin C flush, because of the flush, it carries whatever the bad in the gut out of your body. It actually works like enema, So basically for convenience, and also when you do enema, probably you may disturb the physiology there as well, So that's my opinion, yeah. And I use this approach to treat dysbiosis, to treat a lot of issues, particularly food poisoning. Anybody who eats the bad, I said, take a lot of vitamin C, flush it, yeah. All right, it's getting late. Thank you again, and let's stop here. And if you have any more questions, you can post them. 2 more questions, okay. All right, let's answer those 2 more questions then. Okay. Okay. Let me say that basically for root canal treated teeth, we don't do root canal. Okay. Basic question is for teeth that require root canal, can we directly extract and do implantation? Yes, that's exactly the recommendation. That's what I did. I had a basically bad tooth a couple of years ago. I know this. So I had a 3D X-ray of my tooth. I found a little abscess. Yes, apical abscess. I had that tooth extracted, and then I had a ceramic implant in place. Okay. The last question again. Same question actually. All right. Okay. All right. Thank you very much, everybody. And I'm very glad that Coco came, and we want to basically use every bit we can. So we like to sort of promote dental health, hopefully promote in biological dentistry here as well. And we're going to have a signing ceremony here for collaboration, intent to collaborate, and across the continents, here in Asia, in China, there was Europe and the United States. Again, thank you all for online audience.